control of the body and just continue growing abnormally. Between 50 and 75% of breast cancers begin in the duct, and I'll show you a little bit about that. 10 to 15% begin in what we call the lobule, which is where the milk is made. And here's a structure. So what we see here, the nipple, the areola, and these structures here are what we call the lobes or the lobules. That's where the milk is made. And the milk is then transported via the duct to the nipple. And this is another way of showing it just from the side. Outside of the duct and the ducts and the lobules, there's fat, lymph vessels, and blood vessels. And for those of you who don't know what lymphatic vessels are, those are like blood vessels, and their main purpose is to bring immune cells, to develop and bring immune cells to an infected area, or if fluid seeps out of the blood vessels to take it up so that we don't have swelling around our bodies. So breast cancer. So what we may talk about the invasive and non-invasive breast cancer. And those of you who either have family members or themselves been affected by this, you may hear this term. Invasive breast cancer is what we consider to be truly breast cancer. When we talk about breast cancer, that's what we're referring to. This occurs when the abnormal cells that forms in the duct then spreads to nearby tissues that's within the breast. But when abnormal cells just grow in the milk duct and have not spread, we call it ductal carcinoma in situ. And this would be all lobular carcinoma in situ. And for example, so this is the lobule here. A normal lobule look like this. There's a layer of cell on the outside that makes the milk, and in between the lumen. The cancer cells develop from these cells on the outside, and it grows within. If it grows within, that's what we call lobular carcinoma in situ. It's controlled, it's localized. Surgery essentially cures this. But many times this cell grows outside of the confinement of the lobule and then gets to other parts of the breast, like the blood vessels and the lymphatic vessels and the fat. And now these become a conduit for these cells leaving the breast and to go other parts of the body. And that's when we call it invasive lobular carcinoma. This is similar in the duct. So this is a duct here. If you took a cross section of it, that's what it looks like, a layer of cells with a lumen in between where the milk passes. These are the cells that become cancerous. When they become cancerous, they can either grow within the duct and be localized there. We call it ductal carcinoma in situ, or it can spread outside. And this is really what threatens the life of a woman or a man, because these cells now have the ability to spread to the other parts of the body. When we try to understand what breast cancer is, again, we talked about the non-invasive, meaning it's just within the duct, surgery cures this. The invasive one, the one that grows out and threatens the life, we can often have what we call recurrent breast cancer. You've had it before, we treat it and it came back, and it can be locally. And the worst type is what we call metastatic, and that's what we consider incurable breast cancer. It is spread from the breast to other organs. And when breast cancer, or most of the cancers actually, spread from the organ from which it's formed to other parts of the body, we can no longer cure it. So oftentimes when a woman presents for treatment, we are aggressive up front in order to try to prevent these things from happening, because if it then happens, we can't cure it. And by cure, we define cure as being able to stop treatment. If in cancer, if we say it's incurable, it means for the rest of your life, you're going to need to be in some form of anti-cancer therapy. If we stop the therapy, the cancer is going to grow. I use the analogy of hypertension and diabetes. When it is metastatic, we try to make it more of a chronic illness, meaning the treatment is just meant to control it. Oftentimes we think of breast cancer as one disease. It actually is not. And this slide looks a little bit busy, but what it's essentially trying to show you that we talked about the localized in situ breast cancer and the invasive. And even within invasive breast cancer, here we have 1, 2, 3, 4, 5, 6, 7 different types. And then we can break each one of these down into receptors: estrogen positive, progesterone positive, HER2 positive. And so even within all of these breast cancer, we tend to put them under one umbrella, but it is more than one different type of disease that each has their specific treatment options. Unfortunately, for folks of color, triple negative breast cancer is the more common. And by triple negative, we mean there are three proteins in breast cancer that we look at: estrogen receptor, progesterone receptor, and HER2. The reason we pay particular attention to those is because these are chemicals and or protein that we know either have caused the cancer to form or cause the cancer to continue to survive. Estrogen and progesterone, those are chemicals, hormones that the body makes that makes a woman a woman. When you were developing into a woman, your body started making estrogen and progesterone, and that what continued you through the path of being female. In male, that hormone is testosterone. Most of our breast cancers utilize estrogen and progesterone as the fuel to continue growing. So one of the treatment you may hear about is a pill, and those are usually estrogen blocker pills. You can imagine if the tumor is dependent on estrogen, then you can, if you block that estrogen, then you could starve it. And HER2 is another protein that's responsible for normal growth of cells, and some breast cancers have the normal amount. So when you have none of these, it's considered triple negative. And for triple negative breast cancer, unfortunately, is a more deadly cancer. It is still, we cure more, first of all, I should say, we cure most, 70-80% of the breast cancers that present to us are curable. However, when we break down the different types of breast cancer, some have a higher cure rate than others. Triple negative has a lower cure rate and unfortunately happens in folks of color a little bit more than it does in others. Breast screening. So it's important to do breast exam. Again, the way I like to think about that, although the current guidelines does not stress breast exams as much as they did before, partly because the studies show that it doesn't affect how long a woman lives, but that's for the average woman. For women with more higher risk, strong family history, depending on your race, knowing your breast is absolutely important. It's been with you ever since you were born. You should know what it feels like, and you should know when something is abnormal. And when you do find it, bring it to the attention of a physician, clinical exam, and then of course mammograms. Mammograms is an important screening tool because not only it allows us to find the cancer early. Remember, any cancers, including breast cancer, the way we cure it is by finding it early. The earlier you find any cancer, the higher your cure rate. A mammogram not only allows us to find it early, but when we find it early, we can actually prevent death from happening. So it's a very good screening tool, and I strongly encourage everybody to do their mammograms. In the US, we generally start at the age of 40 and yearly. Although data suggests that every other year would be just as safe, but in the United States, we do yearly. Please do your mammograms. What does a mammogram look like? Here you have a picture. Essentially, the breast is sort of brought together and an X-ray picture of the breast is taken. We look through the X-ray picture to see if there's any abnormalities. Ultrasounds, most women here who've had babies know what an ultrasound is. It's that thing they put on the stomach to look and see how the baby is doing in the stomach. That's an ultrasound. And then breast MRIs, which are a little bit more sensitive and take a better picture of the breast. Signs of breast cancer. Lumps, importantly. Lump in the breast. Again, the younger you are, especially teenage and early 20s, most of those lumps are what we call cysts, and they're not cancer and not suspicious. When you start getting older, new lumps become more significant. So anything that's abnormal within the breast that you hadn't felt before. Change in the shape and the size of the breast, especially if it's asymmetrical. One of your breasts is shrinking or swelling, that is a concern. The nipple, if the nipple is being pulled in, all your life you've had an outward nipple, but all of a sudden the nipple is being pulled in, or not even the nipple, the skin. The skin is being pulled in, that's something of concern. Discharge from the nipple, especially if it's bloody, that should bring to the attention of a physician. Skin changes, and that is absolutely important. There's a type of cancer we call inflammatory breast cancer that essentially grows through the skin. The importance of that is it can be mistaken for infection in the skin. So oftentimes I have women come to me who says, for the last month or so, the skin has been red and swollen and we've been trying antibiotics and it has not changed. If your breast mastitis, which is infection of the breast, is a true phenomenon, if you present to your physician with a swollen red breast and you were given antibiotics for the first 2 weeks and nothing changed, you should seek more attention to that breast. And again, changes in the skin. All right, so let's talk about some stats about breast cancer. Um, with the infection of skin cancer, breast cancer is the most common malignancy among American women. The cancer that kills more American women is lung cancer, but the cancer that's most common is breast cancer. And part of that, why we don't see as many deaths, is because we're really good at treating breast cancer. Almost 250,000 new cases of breast cancer is diagnosed every year, about 250,000. And of that, about 40,000 women will die of breast cancer in the metastatic setting. That is when it's left and it's traveled to other places. An estimated 2,000 men will be diagnosed with breast cancer, and that data is from 2014, and over 400 will die of breast cancer. So again, breast cancer is not only exclusive to women, it can happen in men, because even in your chest, there is breast tissue. In terms of incidence, meaning the amount of people being diagnosed with, it varied from black and white. The important thing to note from this graph is from 1975 all the way up to probably 2009. Today, those graphs are much closer together. White folks were diagnosed with breast cancer at higher rates than folks of color. However, black folks were dying at a higher rate than folks of color. Than white folks. And there are a number of reasons for that. Some of it is socioeconomy, meaning a lot of folks of color didn't have the insurance and would wait too long to seek care. Some of it is the care being treated differently than the other people, your other peers. Some of it is not having the resources at the clinics or the hospitals that you go to, but a big part of it is biology. We talked about folks of color being diagnosed with the triple negative, the more aggressive type than others. A big part of it is that. But this gap is quickly closing because we're doing a lot of work in that respect. So some facts on myth. Is breast cancer preventable? It's a myth in that, in general, it's a myth in that the true cause of breast cancer really truly remains unknown. It's not completely preventable. We do have some medication like tamoxifen and relaxafen that has been approved to reduce the risk of breast cancer in certain women with high-risk disease or women who've had what we call the ductal carcinoma, the localized cancer. But for most part, only about 10% of the breast cancers we know is associated with a genetic mutation. Genetic mutation meaning a change in your DNA that you got from your family member that puts you at risk for developing breast cancer. There are behaviors that increases your risk for breast cancer, and we'll talk about them a little bit, but it isn't a one-to-one ratio, meaning you do this, you get breast cancer. What we know is there's some behaviors you do it sort of increases your risk of breast cancer. So overall, it really isn't preventable. Breast implants increase the risk of breast cancer. Myth. But I put a but there. The but is, so let's talk about breast cancer. There's no scientific evidence to show that either saline or silicone implants increase the risk of breast cancer. However, recent data has shown that special type of breast implants, the one that we call textured. So the implant is coated with a particular chemical that prevents the breast or the implant from the body from reacting to it. That has been shown to increased risk, although minimally, of a different type of cancer called anaplastic large cell lymphoma. Now, those things are outlawed, and most folks don't get the textures implant, but that's the part there, but it does not increase your risk of breast cancer. Having yearly mammogram will expose me to too much radiation, and cancer will occur as a result of that. Really, that's a myth. The benefit of annual mammograms far outweigh the risk of developing secondary malignancy with the very short amount or low radiation that you will receive during screening. And so mammograms are highly recommended. Breast only occurs in women, and we talked about that a little bit. It really is a myth. Men can, about 1% of our cases of breast cancer is seen in men. Overall, the risk is about 1 in 1,000 men will develop breast cancer, whereas it's 1 in 8 women in their lifetime will develop breast cancer. It's not as common, but it's not zero. The majority of women diagnosed with breast cancer have a family history of breast cancer, and I touched on that. It's a myth. Only about 10% can be directly proven to have a direct DNA link that is transferred from family member to family member to family member. But still then, that's important. Family members, there's a lot we don't know. All right, 10% that we know of, but there's a lot that we don't know. I still have a lot of patients who mom had breast cancer, daughter has breast cancer, sister has breast cancer, and when we do genetic testing, it comes back negative. What that means is, yes, it runs in the family. We just yet have not found out what that link is. Okay, but still then, great majority of the breast cancers that we see has no family link. Importantly, if your mother, sister, or grandmother had breast cancer, your risk is increased. All right, and so what we generally recommend is when you have strong family history, we want you to start doing your mammogram about 10 years prior to the younger person having breast cancer. And that's why it's important. And when one thing in our culture is that oftentimes women like to hide their diagnosis. It is important that when you get diagnosed with cancers, especially breast cancer, that you share that with especially the women in the family, because they need to know, and you need to know what your risks are. If there's a genetic link, there's specific drugs that work better in you than otherwise. So if you're sitting on an island with breast cancer and think that you're the only one who had it because your mom had it and she kept it secret, your aunt had it and she kept it secret, then we won't test you and we can't give you the most appropriate therapy. And again, even if we don't know the genetic link, if you know it's strong in your family, then women tend to be more aware and do their screening more appropriately. Antiperspirant and deodorant can cause breast cancer. That's a myth. There's no data, no clinical evidence that link on the deodorant or antiperspirant to breast cancer. And I hear that all the time from family and friends. So let's talk about where we are with breast cancer and where we used to be. So then, 75% of women diagnosed with breast cancer survived at least 5 years. Every year, every 5 years, we're increasing the cure rate. Now, over 90% of women diagnosed with breast cancer are expected to live and survive 5 years. Previously, 5 years was our timeline for considering cured. But again, people are living so much longer now that we have women living 20, 30, 40, 50 years, that 5 year mark really is arbitrary right now. Then investigations were just beginning into using multiple drugs for the treatment of breast cancer and hormonal therapy and had not been fully developed. Now combination chemotherapy drugs are standard of care for certain stages of breast cancer. So I will tell you, when I speak to my patients, especially the newly diagnosed, I often draw diagrams trying to have you understand what the treatment approach is going to be. It's true that the cancer developed in the breast and it's in the breast, and for most women, they think this is what we have to treat in the breast. But keep in mind, a tumor, for our mammograms to be able to see a tumor, it has to be somewhere between 3 millimeters to 1 centimeter in size for us to be able to see it on a mammogram. For you to be able to feel it, it has to be about 1 centimeter. 1 centimeter of tumor has about 1 billion cancer cells, which means this thing has been growing and dividing and dividing and dividing before you're able to fill it. In order for it to grow, it needs nutrients. So what it does is it develops its own blood vessels to feed it with the food that it needs. Once it does that, it now is growing in really close proximity to blood vessels, which means that it has a high chance of sending some of those billion cells into circulation. Now, so when I see a woman, I talk to her about curing this cancer, I say, this cancer started in the breast and we need to cure and treat the breast. But in order to cure you, we also have to sterilize the rest of the body, because there's a good enough chance that the cancer has sent friends out already. And if we just treat the breast and ignore the rest of the body, then we're going to end up in the incurable space. So our treatment, like chemotherapy, how it's important is it's put in your vein and it goes all over the body and tries to find those cells that have already escaped the breast in order to sterilize that so we can stop treating you. The only surgical option was mastectomy, in which the entire breast was removed. Way back when we started developing treatments for breast cancer, it was once thought that, again, the cancer is in the breast. What we need to do is remove all the breast, all the muscles, all the lymphatic vessels. So people used to have really what we call radical mastectomies. What we found is you don't need to do all of that. All right? You don't need to, we've moved from the radical mastectomy to modified radical, where we only remove the breast tissue and a little bit of the lymph nodes, no muscles removed. But then we extended that to say, do we have to remove the breast? And studies after studies have shown what we call a lumpectomy, removing just the lump with radiation to the breast, is equivalent to a mastectomy. And I'll repeat that. If you have cancer in your breast that is able to be removed via a lumpectomy, meaning the surgeon goes in and removes just enough to take the lump off and take all of the tumor off from the breast, and you receive radiation of that breast, it is as equivalent to removing the entire breast. A lot of women now, and even before, come in and say, this cancer is in the breast, so I need to remove both my breasts so that this will never happen again. That makes sense when you think about it, because that's where the cancer starts. But the reality is, if you've had breast cancer and you got the appropriate surgical treatment in your breast and radiation, 95% of the time, if the tumor is coming back, it is not coming back in the breast. I'll repeat that. If you've had breast cancer and you've had the appropriate surgical treatment with radiation when needed or when required, if this tumor is coming back, it is not coming back in the breast. So removing your breast to lower the risk does not make sense mathematically. So if you can save your breast, I would strongly recommend that women save their breast. Then and now, no gene has been identified to increasing the risk of breast cancer. Now we know about 30 or more genes that have been identified to be associated with breast cancer. And by genes, we mean part of the DNA that's responsible for functions in the cell. And so what happened in a gene, for example, the most common gene is called BRCA1 and 2. What those genes are responsible for is protecting the cell from becoming cancerous. They're what we call tumor suppressor genes. So once you have a mutation in those genes, they're no longer working. The DNA cannot repair itself as well, so folks are at higher risk of developing breast cancers, and that can run in families. What are risk factors for breast cancer? Age. The average breast cancer patient is upwards of 60 years of age. It is lower in folks of color between 55 and 60. In Caucasian, it's right about 60 to 62 years of age. And that's just because you've lived long enough, the machinery in the cells don't work as well, so they're more likely to have errors. And so that's how cancers show up. Ethnicity. We talked about that Caucasian women having a higher incident, although those curves have come together and it's probably equivalent now. Though African American women are more likely to die of this disease. And we talked about all of those factors around it. Genetics, about 5 to 10% of breast cancers have a hereditary link. BRCA1 and 2 genes are the most commonly known. Family history. The overall risk of developing breast cancer is increased if there's a family history of the disease, most notably first-degree relatives, your mother, your sister, your daughter, anybody close to you that way. So once if you come to my clinic for breast cancer and it's in your family, then I would normally recommend what we call genetic testing because it can change how we treat you. It will also change the recommendation to your family members. So if you've had a genetic mutation, it means that everybody who's related to you by blood is at risk of having that mutation too, even men. And so we would get them tested. It's important that the person who's affected be tested, right? Because you have the highest risk of having it. So for example, I have women who come in and their daughters are concerned and the daughter wants to get tested. I say, no, let your mom get tested because your mom can't give you what she doesn't have. So if she has it, then she can pass it on to you. Otherwise, no. Dense breast tissue, DCIS, LCIS, previous radiation exposure, especially what we call mantle cell radiation that irradiates the entire chest over time, have increased risk. Exposure to estrogen. Again, we talked about most breast cancers loving estrogen. The estrogen is a fuel. So child after the age of 35. So earlier, the more children you have, the lower your risk of having breast cancer. And that's because every time you have a woman has a baby, she has 9 months break from estrogen. The ovaries shut down, no estrogen production. So the more you have, the less exposure you have over time. Oral contraceptive essentially are estrogen, low dose estrogen. Again, postmenopausal combined hormonal therapy, again, that's giving a woman who's gone through menopause estrogen. Those all increase, so lifetime exposures to estrogen, early menarche, if you had your period before 12 years of age, or late menopause, again, increase exposure to estrogen over time. Obesity, really big, meaning what we know is fat tissue can not only produce estrogen, but it can be a storage for estrogen. So the more you have, the more fat you have in your body, the higher your risk for developing breast cancer, and also the higher your risk of having recurrent disease once you were treated. Alcohol abuse, meaning 2 to 3 alcoholic beverages a day, increases your risk by about 20% of having breast cancer. So, breast self-awareness, what do we need to know? Again, of all what I've said here, talk to your family about it, learn about your family history because that's important. There are therapies that are specifically active in folks with genetically connected breast cancers. Not only that, I talk about breast cancer. So for example, the BRCA1 and 2 genes, if a woman has it, she's not only at risk for breast cancer, but she has a 40% risk of developing ovarian cancer. There is pancreatic cancer. So there are other types of cancers that are also linked to those mutations. All right. So even if a woman presents to me and she has breast cancer, but there's no other breast cancer in her family, but her dad has prostate cancer, which is another link. An uncle had pancreatic cancer, then that's also a concern because those cancers also show up with those mutations. So it's important to learn your family history, talk to your provider about your personal risk for breast cancer, most importantly, know your breast, do your screening, and even if in every city there are either the county hospital or there are clinics that will provide you with care mammograms, even if you don't have insurance. You just have to be persistent and find out about it. If you have a mass in your breast, please don't ignore it. I have had patients who try to wish it away. No, don't wish it away. All right, because the longer you ignore it, the faster it grows, the more likely it is to spread. I get the other part, and I'm talking to believers here. The other question, the other statements I get from women a lot, and more women of color, is that God will take care of me and God will help me cure this. That is true. All right, He'll help you if you believe. But what I think a lot of folks are ignoring is He put you in my presence so that I can help you cure this. Right? He gave me the knowledge and the expertise. So He's putting you here. That is His way of telling you, yes, this is how we get you to treat this and cure this. So staying home and ignoring your doctors and thinking God will just make it disappear, it's not a wise thing to do, because really He's allowed folks to gain the expertise and the knowledge to allow you to get the treatment that you need in order to treat your diseases. Cancer prevention: achieve and maintain a healthy weight, be physically active. So what we've recognized even more in more recent time is the importance of your immune system in helping to fight diseases, including cancer. Right now, we have drugs that they themselves don't attack the cancer cells, but all they do is allow your immune system to recognize the cancer, and the immune system eradicates the cancers. So anything that allows you to boost your immune system, healthy weight, exercise, proper diet, is absolutely important in helping you not only prevent disease, but fighting disease. Eat healthy diet, really limit alcohol consumption. Early detection is key. Self-breast exam is a breast self-awareness is important. Self-exams, timely screening. And I will end there if you have any questions.
Okay, does anyone have any questions for Dr. Vidal?
Yes, I do.
Okay.
What is the cause for now is getting more prevalent for men to have breast cancer? What is it that we're doing, or is it something that we are doing or not doing?
So the rate of breast cancer in men has not increased. It's always been about 1%.
Mm-hmm.
We're just, I guess, it's just out there more that men are also exposed to breast cancer. But once you brought it up, again, alcohol. Alcoholics, if you look at the body of alcoholics, they're more likely to have sort of breast tissue. And so that sort of increases your risk of having breast cancer. Family history: if somebody has a BRCA mutation in their family and the man has it, you have a higher rate of breast cancer, but also prostate cancer and other cancers. Again, your chances of having